Good morning. It's a pleasure to address you as Labour's Shadow Health and Social Care Secretary. And I'm sorry I can't be with you in person at this important conference. But I'm pleased, and it is indeed fantastic to learn that there are so many experts around the world attending this conference today, coming together to share insights on an issue that affects us all. This has been a global pandemic. COVID has been international. And even though different countries have experienced the brunt of this virus at different times and to different extents, its impact on our mental health and well-being has been universal. Here in the United Kingdom, the effect of COVID on mental health has been simply devastating. We can see from the record-breaking 1.41 million people who were in contact with the NHS mental health services in April 2021. The health and care workforce themselves have been battling to save lives during the crisis, but the impact of them has been severe. Although the pandemic has placed this unprecedented strain on our health and care system and the people who make and work in our health and care system, we shouldn't kid ourselves. The mental health crisis amongst healthcare staff has existed long before COVID began. For years, stress, anxiety, burnout, psychological illness has consistently ranked as the leading reason for sickness absence across the NHS, currently accounting for a quarter of all NHS staff absences. The think tank, the King's Fund, has said that NHS staff are 50% more likely to experience high levels of work-related stress compared with the general working population. Of course, our healthcare system is chronically understaffed, and we cannot afford to lose any more of the precious workforce because they are sick with stress or burnt out. We're already asking people to do too much, asking them to do more and more with far too little support, with less and less. And the psychological well-being of staff impacts on patient care. And it's more important than ever that staff feel resilient in the face of an enormous backlog for elective treatment and a difficult winter ahead. Now, of course, to meet these challenges, we need a system that is properly resourced with enough staff and enough equipment to do their jobs effectively. We need to recruit more staff. We need to pay staff properly, and we need to offer each and every one of our health and care staff well-being and mental health support. Providing healthcare workers with effective mental health and well-being support is critical to keeping staff in jobs and ensuring they are happy and fulfilled in their work. Making the tools available to help the staff build mental resilience to cope with the difficult and demanding aspects of their job is a critical part of delivering this. With experts in nursing on the panel today, I could not speak without paying tribute to nurses in particular and the selfless work they do for all of us. All nurses deserve to feel valued and fulfilled in their jobs, and it's essential we do everything we can to provide them with the support they need to manage the stressful and difficult situation that they are often exposed to. There is no vaccine for mental health issues, but that doesn't mean we can't take steps to protect their well-being and build resilience. And as with tackling physical health emergencies, we need to come together to develop tools to mitigate impacts and equip people to face difficulties head-on. That's why events like this are so important. By coming together today, I hope we'll all be able to share valuable insight about what works best, what best practice, what success looks like in developing tools to support well-being. You don't need me to tell you that the past 18 months have tested us all. Each one of you here today has experienced it for yourselves, but the least we as a society owe to those who have given so much to care for others throughout this crisis is to support them when they need it. Building resilience in a post-COVID world is a complex task. Of course it is. But when I think we can all agree that this pandemic has been an unprecedented challenge, and I hope we can pull together and let's learn from it. Let's raise awareness of mental health and well-being issues. And now let's genuinely develop strategies to build mental health resilience for our health and care staff, to whom all of us owe so much. Enjoy the conference today.